runner does have pain, what can they do to actually help with that they can actually still run? You mentioned the taping technique. That sounds quite good. Is there anything else that they
Yes.
can do?
So you can go for the silicone wedges, which are readily available both online, and you can get them in the sort of Dr. Scholl's department of Tesco's or any of the major supermarkets.
Yeah.
Tesco's, Sainsbury's, all of them. They all do the interdigital wedges. And again, all we're trying to do is retain that position of the big toe, trying to get it back into a straight line.
Mm-hmm.
It reduces the stress in the joint capsule, and also you can sometimes get a bunion that forms over that area there, and you can get, sorry, not bunion, a bursa.
Oh, yes.
Which is a little fluid-filled sac, which protects the protruding bone. Mm-hmm. And you can get a silicone sleeve that stops some of the friction on that.
Okay.
And that works quite nicely as well. Orthotics work quite nicely as well to reduce pain. An insole, a simple insole. So I use an insole for running for this particular reason. Very simple. It's just got a first ray cutout to allow my big toe to drop into this gap here. Mm-hmm. And that encourages as much movement out of the big toe as possible. It's got a little metatarsal dome built into it, which pushes up underneath the lesser toes.
Stops that clawing effect being quite as bad. So I don't know if you can see my dodgy trots.
Yeah.
So if I push up underneath there, see what happens to my toes?
Yeah, lovely and straight.
Straightens them out. Okay. And then I also use silicone toe props to lift them up a little bit as well, to straighten them out, as well as doing intrinsic exercises, which we'll come on to in a minute. And then the final feature in this is it's got a little wedge under the heel towards the inside of the heel to turn my foot out a little bit. And that helps with reducing the kind of stretch on that joint capsule as well.
Yeah.
So some really good sort of factors within an insole. So insoles definitely play a part of the rehabilitation process for this and keeping you guys running. And I think, Marika, you felt the benefit of an insole in this particular picture.
Absolutely.
I certainly have. So moving on to footwear, which is a key part of this. So if you can see that trainer there, Marika. Mm-hmm. Okay, this here, you can see on this design here, this A6, as it comes down, that stitching comes right over where my bunion would sit.
Okay, yeah.
And that would irritate the hell out of it.
Okay, so you don't. I was sitting there thinking, oh, so it can stop it. Okay, no, so avoid.
No, it will irritate it. That will really irritate.
Okay.
So, have a look at your trainers, and you'll see on my particular trainer here, where my bunion sits there, I've actually got a nice gap. So there's nothing there that's going to irritate on my bunion.
Okay.
The other thing that I do as well, I was going to show you a very simple trick with the laces. So to stop the laces pulling in at the front here too much and pulling on that side there and irritating that bunion. Can you see that?
Yes, yeah.
Okay. What I'm going to do, instead of lacing it right from the bottom, I'm going to skip the first set of lace holes, like so. And by doing so, it just allows a little bit more space at the bottom of the train leg. Can you see that?
Yes. Interesting. Okay.
So all I've done is just skip that first lot of loopholes there.
Yeah.
Okay. Another thing you can do, which I know is completely counterintuitive, particularly when you've gone out and spent a fortune on trainers.
Are you going to make me cut my trainers?
I'm literally going to mark where my bunion sits and just take a scalpel or a Stanley knife and just cut across in that area.
Okay.
And that would, again, will just give you a little bit more room there. Alternatively, you can take it to a good old-fashioned cobbler and see if they can stretch it for you.
Okay. Yeah. So there's more space. Because I have to say, when I run, it always feels as if, and I try to get wide enough shoes, but it feels as if the shoes are pushing my big toe over. So I've now gone for Brooks in the end because that's the only one that feels wide enough at the front.
Yeah. There's a really good, I think it's Runners World did it last year. All the different types of trainers that are good for bunions. They give you that room. The trouble that we have, Marika, is that if we accommodate the width of the forefoot, we're quite often left with a narrow heel which is rattling around in the back of the trainer.
Yes.
Which can lead to obviously blistering, but also problems with Achilles sort of irritation, Haglund's deformity, or pump bumps, as the Americans like to call it. So if that is the case, or if you pick your trainer up and you look into the back of your trainer, you can see there's a lot of excessive wear at the back here.
Yeah.
There's a good chance your heel is rattling around in the back of that heel.
Okay. Yeah.
Okay. So what I do on my running trainers is I'll leave that first loop free. I'll then lace up as normal. Now on the top of my foot here, I've also got an extra bit of bone growth.
Okay.
Which is this joint here. Because of the mechanics of my big toe now not being quite as effective as they were, got a little bit of extra bone growth, sort of an arthritic change to that midfoot here. And that irritates as well. So you can get that, a lot of runners will complain of that kind of dull ache or even a buzzing feeling or sometimes a burning feeling in between the first and second toes.
Yeah.
So I'll just show you a lacing technique for that as well. And this works quite nicely. And I use it with a lot of people. So instead of coming across at that point on my foot, I come straight up like so.
Okay. Yes.
And that allows a little bit more room over that area there.
Yes.
Where that bony lump would stick up.
So you're essentially leaving a little gap for it and then you're just continuing across after that.
Absolutely. You don't lose a great deal of sort of stability in that, really. So it's quite a nice little technique. I'll then carry on lacing as normal, and I'll just go through this very quickly.
And it is funny, it's with so many things in sport, there's a lot of common sense involved, isn't there?
There is, yeah. And then until someone shows you, then you go, oh, why didn't I think of that? Why didn't I know what that was there for? And most runners know this trick, but you've got that extra eye hole there. And this is called the lace lock. Not to be confused with the triathletes lace lock that they use for quick transitions.
Okay.
You know, the kind of toggle that they use to lace up.
Oh,
so
yeah.
What I do is I create 2 bunny's ears like so.
Yep.
Okay. I put my foot in the shoe and I take the opposite side's lace and I put it through that loop, then that side through that loop, and then put it up nice and tight like so, and do it up as normal.
Okay.
What that does, it creates an extra anchor point at the back of the trainer and stops some of that movement at the back of the trainer.
Okay.
That way you can accommodate the kind of triangle that you're faced with, that wide forefoot and narrow heel, and hopefully will give you a better sort of ride comfort in that trainer when you're using it.
It's interesting that you say that, because the person who asked the question about the splints for bunions, she described her feet as monkey feet, that they're really wide at the front and narrow at the back. So that would fit exactly into that.
Yeah, that's absolutely classic of the picture that we see clinically as well.
Okay.
And you get so many problems with people with that, that really problematic foot type. It's a triangle, and it's such a difficult thing to address. And ladies tend to have more of a triangular shaped foot anyway, that wider forefoot and narrow heel. So, that's hopefully a little tip that will help everyone.
Yeah, no, definitely. I'm going to go try that out. I'm not sure I would cut my trainer yet, but I may work my way up to that.
You don't have to do that. You don't have to do that until you've tried everything else.
Thank you for watching. If you would like to learn more about preventing sports injuries, make sure you hit the subscribe button. See you next time.